so of course I had to stay for his talk too. So thank you for coming. It's a pleasure to be here. I'm the medical director of Lingkod Timog, and we just came back from a medical mission in Davao. And it's always very educational and exciting, and you're all invited to join us next year and speak with Dr. Santos about that. But what I'm going to talk to you about today is epilepsy and comorbidities. I'm going to try and give you some general background about epilepsy and then talk about some research that I've done that has to do with comorbidities. So I'll try and walk you through the slides. And I'm going to be turning that way. Let me see if I can stay with the microphone so that you can hear me. Okay, so I'll just ask, we did see just a couple days ago a young woman who was 37 years old who told me that she had epilepsy, that it started when she was 18 and that she had convulsions. Eventually she had a single evaluation where she had a CAT scan and was started on medication. She continues to have seizures, and that's why we were talking just the other day, and I suggested that she increase her medication that she was taking, which was problematic because she had a budget issue and she needed to double her dose, and by doubling her dose she was doubling her expense. And so I don't know how successful that's going to be. But has anyone here seen someone have an epileptic seizure? We have, raise hands high so I can see. Oh, so wow, quite a few. I would say at least a third of the group without being too quantitative about it. And I've seen more epileptic seizures than most because one of the things I used to do was to direct an epilepsy center where we would bring patients in and videotape them during their seizures while we were recording EEG at the same time, brain waves, so that we could determine where the epileptic focus was. And so I would spend most of the day watching these videotapes and trying and synchronizing the patient's seizure with what was happening in their brains. And without exaggerating, I have seen thousands of epileptic seizures. But even me, I found it very disturbing. How many people were disturbed or felt uncomfortable when they saw a seizure? I don't know. It's a very frightening thing. So how many people know what epilepsy is? The definition is difficult, so I'm going to walk you through some official medical definitions that might be helpful. Okay, so here's a long one. Epilepsy is a group of disorders of the brain characterized by an enduring predisposition to generate epileptic seizures and by the neurobiological, cognitive, psychological, and social consequences of this condition. Okay, so that's kind of hard to summarize. Let's move on. Seizures, a transient occurrence of signs and or symptoms due to abnormal, excessive, or synchronous neuronal activity in the brain. So what you saw was an epileptic seizure, and Hewlings-Jackson, a famous neurologist, was the first one to put this together, that these abnormal movements, a convulsion or a staring spell, or it could be just a jerking of one hand, was due to a group of neurons in the brain that are all discharging in synchrony, which they're not supposed to do. So, and you can liken that a little bit to an abnormal heart rhythm. If you think of an EKG, you've all seen EKGs. So a brainwave test is looking at the electrical activity of the brain, just similarly to the way you would look at electrical activity of the heart. And as there are many cardiac arrhythmias, there are also brain arrhythmias. where is the best direction to point this so that it does what it's supposed to do?